Good evening, all. So, welcome all aspirants to this interview. So, it's my proud privilege to introduce Dr. Anurag Divakar to this interview. He is 2025 AML INICET rank 1 in Pediatric Neurology. So, first of all, let me congratulate him for this stellar performance. Congratulations, Dr. Anurag.
Thank you. Thank you so much, sir.
So we'll start the short interview with a brief introduction of yours, like where you did your UG, PG, and all. Over to you, Doctor.
Sir, I am Dr. Anurag Divakar. I am from Satna, Madhya Pradesh, and I did my MBBS from AIMS Bhopal, and then I did my MD in pediatrics from AIMS Jodhpur, and then I did 2 months of SRship from there only, and then I took a break of 1.5 months to prepare for this exam.
So I know this is your second attempt. So last attempt you had cleared the theory.
Yes, sir. Actually, I gave that exam with my MD exam. So I was able to clear the theory part, but I was not called for the interview. Marks were little less.
But it's great that you could clear the exam even when you were doing the MD. That was in such a busy institution. So your MBBS and MD both were from AIMS, different AIMS. Now you are going to AIMS New Delhi, the Apex AIMS. So it's actually, I should say, it's a stellar journey.
Yes.
And welcome to the world of pediatric neurology. So how did you get interested in pediatric neurology?
Actually, in most of the OPDs, sir, almost 50 to 60% of the patients were from pediatric neurology only. And we had a good department of pediatric neurology. Dr. Lokesh Saini sir was there. And whenever we used to see any patient and whenever there would be some dilemma and when we would see any typical findings of some diseases, so that would fascinate. And also when suppose some patients of like ANE also gets treated after immunotherapy, that's give huge confidence to like that. In neurology also the patients can get treated and can go from the hospital after discharge walking.
Yeah. So Dr. Lokesh Saini is a great teacher, and I was fortunate to be his junior during my MD.
Okay.
And yeah, he was. His students always get represented in all the pediatric neurology and pediatric workshops as a supporter platform. So it's great that you are his student. Now, what do you think about the pattern this time in the exam?
The pattern of the exam was, I think, quite similar to last year also, because I think almost 6 to 7 questions were repeated from the last time only. So, and also there were a few repeats from previous years also. So almost 10 to 15 questions were repeat only. Either topic was repeated or the same question was repeated. And in general pediatrics part, they last time they asked more from endocrine and specialty other than specialty based. But this time they asked like the general pediatrics part only, like the ABG, the ventilator part, or the other question like TRMA. They asked and anemia. There were 4 questions on anemia. So they asked mostly from the typical topics they tend to ask in the exams.
So these were like direct questions, or it was tweaked or based on like a clinical scenario is given and then ask the question?
Yes, in like 20-30 questions, there were case scenarios of 2-3 lines max. And then there were either option, there were one-liners also, and there were true false also, which of the following is correct, which of the following is incorrect. There were that type of questions.
So time wouldn't have been an issue, right?
No, sir, time was not an issue. I could complete the paper 10 minutes. There were 10 minutes remaining before I could complete the paper.
Okay, so that's also dangerous. Then if you're getting idle time, you'll be going back and correct and making changes in whatever you have attended already.
Actually, this time they changed like the flagged questions or the marked for review questions were not counted. So I did not mark any question for a review, and then I just left 4 or 5 questions which I thought I am having doubts on 2 options. So I reviewed them back and corrected it.
So in the pediatric neurology portion, which were the hot topics?
Hot topics: epilepsy, inborn error of metabolism, and then neurodegeneration, and neuromuscular muscular dystrophy was mainly asked, and newer drugs like profenatide was asked, lariglitazone in X-linked ALD was asked, and genes were asked about like various epilepsies, FCD. There were many questions on that.
Were there any MRIs, EEGs?
Yes, sir. 2-3 MRIs were there, and 1 EEG was also there, sir.
So were they like easy ones or predictor ones or difficult?
Actually, case scenario was there, and it has the typical delta breast pattern of EEG.
And in the MRIs?
And in MRI, I think there was only 1 or 2. I'm not sure. PCAN ka,
the usual question, the typical current variety question.
Yes, sir.
So how did you prepare for the interview? You got, I think, 1 week for the preparation of the interview, right? After the results were out.
Actually, 5. Yes, sir. 1 week we got.
Okay. So how was the interview?
Interview was actually, I didn't prepare much for interview because from most of the seniors which I asked, they said the interview is just like they will ask basic questions only, and they gave some selected topics. You should read these things, and also when you took the mock interview round, you told just you all are well prepared and you should go with a chill mind. So I did that only, and I just revised a few topics from biostats, and I read a few like how to describe the movements, and because there was going to be a video-based question, so I tried to describe those questions. And luckily, 1 question on chorioathetosis came also, and then there were 3 questions on neurology viva, and there were 5 questions of general pediatrics departmental assessment.
So if you are prepared for the theory exam, there is no need to prepare separately for the interview. That's what you think.
Yes, actually, very few topics which are not asked in theory you can read, like precision medicine. Although we read in theory, but here we have to enumerate the things. Like they will ask 10 examples of this, 5 examples of this. So that should be on your tip of your tongue.
How did the Marrow and Marrow videos help you in preparation?
Yes, sir. I could not watch all the videos, but a few selected videos that I watched, and I did the whole question bank, sir. And I revised it also 2 to 3 times, all those questions which I did wrong. And actually, there was a lot of information given in the Q bank description of answers. So what I used to do, I used to take out some points and add in my notes.
Nice. So you were depending on Nelson or other textbooks also were there for pediatric neurology like Swyman or Finchel?
Yes, sir. Actually, initially I started with Swyman. I thought that would give me a base, but after I started reading important topics only, like white matter disorders and muscular dystrophies. 5-6 important topics I read from Swyman, and then I talked to my seniors. Then they told me most of the questions will be from Nelson only, so you need not to cover Swyman. So I started reading the Nelson, and they told me read Nelson from cover to cover. So I started reading, and from the previous interviews of toppers also I saw, and they said most of the questions are from Nelson only. So I read neurology portion and neuromuscular portion cover to cover from Nelson, and then I used a few other sources, and I did question bank completely, and I did a few past year papers.
Basically, you had a kind of a flawless preparation, I should say.
Yes, initially I started with Swayman, but later I did not read from Swayman. I just stick to Nelson only. And for like special topics like neuroanatomy, they'll ask, and the anatomy and the physiology, neurophysiology, they'll ask. So I refer to the PG notes which I had made. So I refer to those topics.
So, congratulations again. Then, is there any suggestion from your side to improve my videos? That's a personal question.
Yes, sir. Video was fine only, sir. But tests were a little more difficult on the difficult side. And I thought the tests were a bit more difficult. And like in these in INISS, they usually ask the most of the questions will be simple only, and they will not twist and turn the questions much. They will ask simple, what is the gene in this? They will give the case scenarios. So I think that could be a bit improved. GTs, I gave a lot of GTs, so that's why initially I used to do a lot of mistakes, silly mistakes, 10 to 15 silly mistakes. But I don't know how in the main exam, I just started doing, and those questions also, which I was not sure between 1 and 2, it got correct. So
It's clear that you had a very meticulous preparation. So definitely found through. So what's your message to other aspirants who are preparing for next pediatric neurology, INACT, and NEET tests?
like whatever subjects they are giving in for like pediatric neurology, most of the questions are from Nelson only. And for general pediatrics part, they'll give the most important topics only. So it is not necessary to cover everything, because you won't be able to revise that much. So I think reading Nelson once or twice and reading the important topics multiple times, that is going to help.
In the lessons, there are many long tables, right? How do you manage that? Well, they'll be giving like 20 names of genes.
Yes, sir. Actually, from the past year papers, we can guess like which are the important tables. Like in the developmental disorders, they will ask some genes from holoprosencephaly, or they will ask from FCD or porencephaly. They'll ask one or two genes, or describing the important findings of these conditions. Then from epilepsies, they'll ask 2 or 3 topics from like paradox independent epilepsy, or folic acid responsive, folate responsive, these things. So they'll ask 2, 3 things from the epilepsies, which and 1, 2 question from status epilepticus, 1, 2 questions from anti-epileptic drugs. So there will be predictable pattern that they will ask 1 or 2 questions. It's just that they will ask in some other manner, or sometimes they will ask easy questions. But if we have not read that topic, so we would tend to mark those questions wrong in the main exam. So we have to cover every topic, and the important topics we have to revise it again.
So was there a difference in the pattern between NEET SS and INACT?
Yes, sir, there was a like in pediatric neurology paper which I gave. In neurology portion, the questions were standard only, and they were from the predictable topics, in important topics only. And in NEET SS, actually, they gave topics from every specialty. So you have to be, actually, you should not be very thorough with every topic, but you should have covered every topic at least once. That's what I feel for NEET SS.
So I think we'll wind it up. It was very useful, especially I'm sure for the aspirants who are preparing for the pediatric neurology next time. So again, congratulations for you again. furthers performance, and welcome to the world of pediatric neurology. It was very nice talking to you, Dr. Anurag.
Thank you, sir. Thank you.